What about diseases like mania and Tourette syndrome? We often use lithium in the treatment of mania, and sometimes we will use these new agents in combination with lithium. These drugs are approved in bipolar disorder and in Tourette syndrome. I mentioned Tourette syndrome in a later lecture, and we'll cover it in more detail then. Molodone is used in Tourette syndrome, but never in schizophrenia. So we're going to cover Tourette syndrome in our muscle lecture later on. But just remember that this particular agent is not used in the antipsychotic world at all. The treatment of psychosis in patients with Alzheimer's disease and Parkinsonianism is particularly challenging. So if you go back to the dopamine model that I had shown you before, you know that increasing dopamine for Parkinson's disease may help the Parkinson's disease, but it can make your psychosis worse. The opposite is true when you decrease dopamine levels. Decreasing dopamine levels can make your Parkinson's disease much worse, but improve your psychosis symptoms. So it's a real challenge treating psychosis in patients who have Parkinson's disease, for example. That's why these newer atypical agents are so helpful, because they're actually approaching the serotonin portion of our understanding of how psychosis works. And that's why in patients who have Parkinson's disease and to a lesser extent Alzheimer's disease, we use these new agents to treat their psychoses. Let's move on to emesis and nausea. Remember that these agents are also active in the chemoreceptor trigger zone, which houses the vomiting center of the brain. In fact, most phenothiazine antipsychotic agents have very good antiemetic properties. A classical example is Stemetil, which is an agent that we use all the time in nausea, particularly in patients who have been given chemotherapy agents and they're really nauseous from the treatment of their chemotherapy. There's a specific issue that I think we need to cover when we're talking about antipsychotic medications, and that is a drug-induced dyskinesia. This is kind of a unique side effect from these drugs. You can get an acute dystonia that's caused by antipsychotics. Remember that benztropine is the antidote to that reaction. Tardive dyskinesia may be due to D2 receptor damage or dysfunction, and fetal alcohol syndrome patients may develop tardive dyskinesia after only one dose of an antipsychotic. So you have to be particularly aware of the side effects of these medications and the motor dyskinesias that you can get or induce by giving even as little as one pill. Listen, tardive dyskinesia is very hard to treat. We use drugs like clonazepam and others to try and treat the tardive dyskinesia that we've induced, but in general, they're hard to treat, they're resistant to treatment. Withdrawal of the offending agent is obviously going to be your first-line treatment.